Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay, corneal dystrophy. Corneal dystrophy are usually they are inherited lesions. They are bilateral lesions which are stationary and they are also slowly progressive lesions. These will progress slowly and these are the slowly progressive lesions that occur. And one important hallmark of this corneal dystrophy is absence of inflammation is important. Now in the corneal dystrophy there are of different types. First, epithelial and subepithelial corneal dystrophy. Epithelial and subepithelial corneal dystrophy is of two types. First, we have microcystic coagons or epithelial basement membrane. Second, we have Meesman's epithelial dystrophy. Then we have epithelial and stromal dystrophy. Epithelial and stromal dystrophy is of three types. We have Rees-Buckler's dystrophy, lattice dystrophy, and granular dystrophy. Then we also have stromal dystrophy. Stromal dystrophy is actually only one type, which is macular dystrophy. Then we have endothelial dystrophy. Endothelial dystrophy is of two types. We have two types. Fuchs endothelial dystrophy is present and posterior polymorphous. These are the types of corneal dystrophies.
thank you and thank you for watching.